I'm Lauren Wareham, and I'm a Research Assistant Professor at the Vanderbilt Eye Institute in Nashville, Tennessee. The primary focus of my research is in glaucoma, which is the leading cause of irreversible blindness worldwide. In the world, there are 80 million people that suffer from this disease. 10 million of those people will become blind in both eyes. In the USA, there are 3 million people suffering from this disease, and this is a number that's predicted to increase to 7 million people by 2050. And the reason for this increase is age. Age is a primary risk factor for this disease, and we are an aging population. By the age of 55, you are 7 times more likely to develop this disease, and the cost to the USA economy is huge. Every single year, it costs the USA economy $3 billion, and these costs come from patient care and patient treatments, and also indirect productivity losses of the people that lose their vision. Many people with glaucoma carry on and progress with the disease without really realizing it until it's too late, and they start to lose their vision. At this point, it's too late. There's nothing we can do at the moment to replace that lost vision. Glaucoma is the most common optic neuropathy, and what I mean by that is that glaucoma is a disease that affects the entire visual system. Glaucoma affects the eyeball, the cells at the back of the eye in the retina called the retinal ganglion cells, and the optic nerve. The retinal ganglion cells are the cells that are responsible for processing all of the visual information from the eye, carrying it along the optic nerve to the brain to allow you to see. In glaucoma, these cells at the back of the eye die. And when you go to the doctor and he or she tells you that you have glaucoma, they will talk to you a lot about intraocular pressure. In this schematic, I'm showing you how intraocular pressure is formed by continuous movement of fluid through the eye. Intraocular pressure is just the pressure that's maintained in the eyeball. In glaucoma, this movement of fluid is perturbed, and sometimes this can result in an increase in pressure in the eye. There are some cases, though, in the clinic where people actually don't develop increases in intraocular pressure. Regardless, it's the sensitivity of the retinal ganglion cells to pressure at the back of the eye that causes them to die. And if this is left untreated, these cells die and you lose your vision. Current treatments in the clinic include drops and surgery, but unfortunately this only serves to delay progression of the disease, and people who take these therapies still go blind. What that tells us as researchers and scientists is that there are other risk factors to this disease that we actually don't fully understand just yet. In my research, I aim to try and uncover whether there are changes in blood vessels in the eye. This is another risk factor potentially for the disease that we don't quite fully understand. My research uses mouse models of glaucoma to try and uncover the mechanisms for why there might be changes in blood vessels in the eye. The retina is very, very active, and the retinal ganglion cells are processing all of the visual information, so it makes sense that they would need a really good blood supply in order to do a good job of providing you with vision. In some patients in the clinic, we do see changes in blood vessels at the back of the eye, and interestingly, some patients also have other systemic blood vessel diseases like hypertension, migraine, diabetes, and they develop glaucoma. In my research, we introduce high pressure into the eyeballs of mice, and we do this by injecting beads into the eye that block up all the channels to perturb the flow of fluid, as I showed you earlier. Then we can use techniques that allow us to visualize blood vessels at the very back of these mouse eyes. As you can see in this video, we are looking at the back of a mouse eye. All of the blood vessels are highlighted in green, and you can see the tiny capillaries. If you look very closely, you can see blood flow through those capillaries. In glaucoma, we think that there are changes in this blood flow and that the blood flow becomes compromised. If the blood flow in the eye becomes compromised, these really important retinal ganglion cells can't get the nutrients and energy support that they require to process visual information. In my research, I'm really hoping to try and uncover just why there might be changes in these blood vessels. What I want to know is whether there are changes that happen early in disease or whether there are changes that happen late in disease, and ultimately whether there's a therapeutic window for which we can treat patients with drugs that can prevent these changes in blood vessels, to enable these cells at the back of the eye to continually be supported by blood and nutrients. And so the ultimate goal really of my research is to try and find an alternative therapy for glaucoma patients that will prevent them from going blind and ultimately prevent blindness in glaucoma.